Unity Point Health Cedar Rapids Heart and Vascular Institute takes you inside the heart for an aortic valve replacement surgery at a Unity Point Health Hospital in Cedar Rapids, Iowa. Our patient is Cory Rainey. He's a 50-year-old Marion man with a bicuspid aortic valve, a condition he was born with and identified 25 years ago by his Unity Point Clinic family doctor. This congenital heart condition led to aortic stenosis.
It's an aortic valve. It tends to leak. It leaked, so there was like almost of a murmur. It leaked when it pumped, so it'd have to pump extra when it would pump, which is hard on your heart. So it needed to be replaced so it don't leak.
So aortic stenosis is the tightening of the aortic valve. The aortic valve typically opens and closes each time the heart beats, and in people over time the valve can become calcified and be stenotic. So each time the heart were to beat, the valve doesn't want to open properly. It puts a lot of extra work on the heart to pump blood out each time the heart goes to beat through a small opening. In his situation, he was born with what's called a bicuspid valve, meaning that congenitally it was slightly malformed compared to what a normal valve is, and that results in an earlier onset of aortic stenosis. So for him today, we're going to replace his valve and put in what would be a mechanical aortic valve to take the workforce off the heart.
Dr. Gary Weide, a cardiothoracic surgeon from Physicians Clinic of Iowa, will be performing today's aortic valve replacement surgery on Rainey. Joining Dr. Weide in the operating room is an anesthesiologist, a perfusionist who operates the heart-lung machine, a physician assistant, and St. Luke's highly skilled open heart team of nurses and surgical techs. Because of Rainey's young age, the decision was made to replace his aortic valve with a mechanical valve rather than using a tissue valve.
The mechanical valve is a valve that's produced from a type of metal. The advantages of this particular valve is that it has basically a lifelong durability. It should hopefully last him the rest of his life. Other valves one can choose from would be called a tissue valve, a valve that's typically produced from the heart sac of a cow. The downside to that valve is it has a life expectancy of about 10 to 15 years. So when a guy who's young and 50 years of age, going that direction would certainly result in another operation at some point in his life. So, he's opted to have a mechanical valve, hopefully for a lifelong solution to this problem. So this is true open heart surgery. We open the chest, we go on the heart-lung machine, we stop the heart for a period of time, we take out the valve, sew in a new valve, and then start the heart once again, close the chest, and hopefully it recovers well.
Another option for aortic valve replacement and treating aortic valve stenosis is through non-surgical treatment called TAVR, which stands for Transcatheter Aortic Valve Replacement. St. Luke started its TAVR program in 2016. Dr. Weide explains how they decide which procedure is best for patients.
These procedures are relatively common. It's probably the most common valve procedure that we do. I would say over the last 4 or 5 years, things have changed dramatically in how we treat aortic stenosis with the introduction of TAVR. The TAVR has really kind of turned the number of patients that were once open procedures now into these catheter-based valves. The TAVR valve is a tissue valve. So in Cory's situation, I think that he did have an option for a TAVR valve, but again, it would have been a limited durability as far as the valve goes. So he opted to have open heart surgery for the mechanical valve to hopefully never have to deal with this again.
Rainey's open heart surgery is expected to last about 3 hours. To access the heart, Dr. Weide makes an incision in the middle of the chest and then cuts through the sternum. Cannulas are then inserted.
So the cannulas are basically tubes that we use to drain blood out of the heart, circulate it through the bypass machine, and then it goes back into a separate tube into the aorta generally that basically pumps blood throughout the patient's entire body while the heart's stopped. So it continues to provide blood to the brain and the kidneys and the liver and everywhere else, so we can stop the heart and then work on the heart while it's not moving and beating and bleeding, so on and so forth. So the cannulas are essential. The bypass circuit's essential to the operation. Well, usually the patient goes on bypass, and then we put a clamp generally on the aorta, and then we deliver what's called cardioplegia, which is a high potassium solution that's used to stop the heart. And then every 15 or 20 minutes, we have to keep giving that solution to keep the heart stopped, but it also protects the heart from injury during that time as well.
Dr. Weide removes Rainey's aortic valve.
So his valve, like we talked about, was a bicuspid valve. It was calcified in the sense that it didn't want to open particularly well, but in addition to not opening well, the stiffness of the valve makes it not want to close as well either. So the valve not only was stenotic, but it leaked.
And replaces it with a mechanical aortic valve.
They come in various sizes for various size people, of course. I mean, the goal is to generally try to put the biggest valve you can put in. At the same time, you got to be able to accommodate it into the heart and into the aorta, so you're at the mercy of that. So in him, we measured 3 different sizes, and we came up with a 25 valve is actually a pretty good size valve for him. Everybody's unique in the sense of sizing goes, and then like I said, we pass multiple sutures around the annulus, like we talked about, and they're, like I said, they're color coordinated and they're kind of individually laid out, and it's important to keep track of all those so they don't get all tangled together. And then we pass them through the valve sewing ring itself, and then slide the valve down over the sutures and then tile the sutures, and that's what secures the valve into the heart now, so it doesn't pop out or move out. Testing is just make sure the valve leaflet's open and closed. It means you make sure that there's nothing under the valve that's impinging the valve leaflets, because they pivot back and forth. So you want to make sure that they pivot fully, they open to their maximal extent, and they close, they come together so the valve doesn't leak. In general, that's generally not a problem. Most of the time when you clean everything out, the valve leaflets will pivot, open and close without problems, but it's always good to double check before you close everything up. There's a lot of ways to close the chest. I mean, the most common way is with 6 or 7 surgical stainless steel wires, and it works well for the majority of people, and that's what we did for him, and I think he'll do just fine.
And does that stay in?
The wires will stay in. I think everything went well. I think everything went as planned. I mean, no surprises, no hiccups. I think the valve, the appearance of the valve is what we expected. It functioned the way that we thought it was functioning. We got it out nicely. We cleaned everything up and actually got a pretty sizable valve in there. So I would say overall it was quite a success. The mechanical valve in particular, he'll have to be on a blood thinner. You have to be on a blood thinner for the remainder of your life, which requires you to get some blood drawn. You got to be on Coumadin or warfarin, so you got to get your blood checked regularly. That's the one advantage to a tissue valve, is you don't need to be on that, but it has limited durability. So you kind of trade the durability for the anticoagulation, and in Cory's instance, that's probably the best decision for him. But long term, he'll go through cardiac rehab after he gets out of the hospital for 2 to 3 months, and then he'll periodically have an echo to make sure the valve is still functioning fine and make sure that it's doing okay. But a mechanical valve in particular, I mean, this should really last him, many, many years, if not the rest of his life.
After his surgery, Rainey spent a day in St. Luke's intensive care unit and 4 days total at St. Luke's.
I'm doing a lot better than I anticipated. I'm very thankful for the help that was here. ICU from that to my departure was wonderful. Surgery I don't know anything about. I went in there, they put a mask on me, and I was done. You're gonna wake up in ICU, so I don't remember anything there. But from ICU to the time of departure was wonderful.
It's been a little over 3 weeks since his open heart surgery, and Rainey is participating in St. Luke's cardiac rehab.
I prepared myself for a lot worse than I have actually encountered. I wouldn't anticipate where I'm at now. That's just over 3 weeks of post-surgery, and I feel great. I figured that I would feel a lot worse. I plan to feel a lot worse.
Rainey will continue attending cardiac rehab and follow up with his doctor. He hopes to put his surgery behind him soon as his body continues to heal, and he looks to return to work in the coming weeks.
It was class act, perfect. Everything went great as anticipated. The post-care has been great. And today I had rehab, and that was great. So from the start to the finish, I had very good care.
Unity Point Health St. Luke's Hospital is Cedar Rapids Heart Hospital. It has been the area's leader in open heart surgery since 1978. We invite you to learn more about our program and St. Luke's Heart Care Services today.